Hello, good morning to all. I am the author of the paper examining the global psychiatry context, which has been just published in the Global Psychiatry Archives. My name is Mohammed Islam. First of all, I would like to thank you to all the editors and the reviewers, which has helped me with their provided valuable suggestions to make this paper what is today. And thank you for accepting my paper. So I'm going to provide you with a brief overview of the paper so that you that know and be familiar with the methodology and what to expect in this paper before you read it. So it might be of helpful to you. This paper is actually a study which focused on the global psychiatric contrast because we all know that in 2023 many of the experts, especially from financial arenas, predicted that the world is going to be a very turbulent planet because there have been many economic crises, there have been many economic instabilities, and we have seen that Sri Lanka declared bankruptcy in the beginning of 2023, and soon after that the Pakistan followed the footsteps. So obviously it created a concern among the citizens, and during the COVID-19 millions of people have died. The government had taken necessary steps such as they introduced novel mental health assistance programs so that people won't commit suicide, but unfortunately many had committed suicide, and it is a great loss to the society because the society was not appropriately prepared for this type of pandemic situation. However, many countries did not perform as to our expectations such as the Asian continents. So in this paper, as I was talking about, in this paper, I have interviewed 35 psychologists, psychiatrists, and licensed psychiatrists from all around the world to get a holistic picture of what the world is or would be going through in the 2023. And I would like to thank to all of them because they have provided their valuable time to communicate with us and share their useful knowledge, and you will find a list of the detailed psychologists and the persons I have interviewed in the appendix. And it is also important to mention that all these people have been involved in the government sectors as well, because many of them have been involved actively and spearheaded many diverse campaigns to address the mental health issues, especially during the COVID-19, such as in Australia, USA, India, Nepal, and United States and United Kingdom as well. So these people had the practical experience, they had the field knowledge of what the people were going through, and we decided to contact them because they were the actually repository of knowledge. We did not want to just conduct searches on the internet, focus on the secondary data, but we want to get the practical scenario of what would happen to the citizens provided the world would be on the verge of economic collapse. So this paper actually represents the findings, and you, after you have gone through the paper or before you have gone through, let me tell you about a little brief of the findings so that you may understand the context simply by knowing or watching this video. In the findings, we have found that the Asian countries have performed significantly poorer, and it is of no surprise because we are aware that in most of the Asian countries such as Bangladesh, India, or Nepal, mental health is considered a taboo. If you are a man or a woman and you are living in geographic location which is based on the Asian continents or the South Asian countries such as Bangladesh, India, Nepal, or the SAARC countries, then it is highly inappropriate to seek mental assistance regarding your psychological well-being. But we all know, according to the definition of World Health Organization, that health is not only the physical well-being of an individual. They have clearly defined health as the psychological and physical well-being of an individual at any given state. So it is of utmost importance that we focus on the psychological aspect as well. So this paper is what it did. We focused on the psychological aspect and we have found many extraordinary findings. For example, the Asian countries have only taken necessary steps to address the citizens' concern, but from the economic perspective. Their health perspective, their psychological well-being is completely ignored in their policies, as we have found by talking with the experts. On the other hand, the Western counterparts have performed significantly better. We can see that they were spearheading many health campaigns, especially the United Nations, the UNDP. They introduced many novel measures to make sure that people wouldn't commit suicide. They wouldn't feel left out during the isolation period or during the society was going through a difficult phase because many people were being jobless. There were a transition period, like a little transformation in the sectors all around the globe. So it was important to address their mental concerns considering these significant changes in the society. So we have found, as I was talking about, the Western nations have performed better, and many of the psychologists were directly involved with formulating policies or measures to address the psychological well-being of their respective citizens of their respective countries. And we have found and discovered as well that they have taken many measures. For example, in the United States, they are fully prepared and they're providing all sort of economic assistance via the government stimulus checks or whatnot to make sure the citizens feel safe because they care about the citizens. But in Asian economies, such as in Pakistan, in Sri Lanka, in Bangladesh, Nepal, all of the policies are actually concerned on economical aspects of the country. The citizens are left out, unfortunately, and that is the harsh truth. So we have found that there's a wide discriminity and disparity as well among the global populace during our study. The Western counterparts perform significantly better, both during and after the COVID-19 period. And the research have also found that it is highly likely they will be performing much better because they have taken adequate measures to address the 2023, because the world is actually changing because of, for the situations such as the Russia-Ukraine war, the economic instability, and the huge transformation that took place just after the global pandemic. On the other hand, the Asian economies performed very poorly. They have not taken adequate measures. Only the few mental programs which you may be considering or which you may be thinking in your mind were taken because it was required by the UNDP or the global monetary foundations to receive their financial aid as a prerequisite. So this simply provides evidence that these countries decided to took the mental health campaigns to ensure that they would get the future economic assistance from the global organization. So in conclusion, I would like to say that this research is the first of its kind because instead of focusing on any country or any single individual or community, we decided to bring the world under one umbrella. So for future researchers, this research will act as a theoretical framework when to be focusing on the psychological well-beings of the community in the aftermath of COVID-19 or in the present context, because we have shown and we have provided evident information with solid uh, data from the practical experts who have actually worked on the field that the world is not in a fair state in terms of psychological well-being or addressing the psychological concerns of their respective citizens by the national governments around the world. In conclusion, I would like to say that the Asian countries have performed significantly poor, and they have been performing so for the past few years, even before the corona, and the Western nations would perform considerably better. And for future researchers, this is an opportunity to explore the various aspects so that the government or the concerned officials will know what to tackle, what to address, what to identify their shortcomings or their choices where they can make improvements. In a nutshell, this scientific study was a culmination of the experts' insights during and after the COVID-19 and what they predicted about the global world's psychological status in the present context starting from 2023. And we can say that it is not very optimistic because we have seen many countries are going through some turbulence periods such as Pakistan, but the condition of the Western countries, although are unknown at this period, but we may simply assume based on the fact that they are not completely unaffected by the global instabilities that are occurring all worldwide. So in conclusion, Again, I would like to thank you, the editor and the respected reviewers for their valuable comments, and most importantly, the Global Psychiatry Archives for selecting my research paper and publishing my research paper on your site. So thank you all. Thank you.